the VCA Voice podcast. I'm your host, Dr. Marie Kerl. Our goal with the VCA Voice is to showcase how VCA Animal Hospitals is taking care of the future of veterinary medicine. We'll bring our purpose to life through meaningful conversations about care, our culture, and the communities we serve. On today's episode, I'm pleased to welcome Dr. Kimmerlein. Anne is the VCA Veterinary Epidemiologist in Medical Operations. Hi, Anne. How are you today?
Hi, I'm doing so well. Thank you.
Excellent. Glad to hear. Well, I want to jump right in with some questions. Let's start off, if you could tell me a little bit about your journey in veterinary medicine.
Sure. So I'm one of those people who I just always knew I was going to be a veterinarian. And growing up, I participated in 4-H. I showed rabbits and I trained my dog in obedience and agility. And my big project was market lambs. I raised market lambs, which I then auctioned off at the county fair every year. So I can't remember exactly when I realized that my desire to be a veterinarian had really as much to do with wanting to help people as wanting to help animals. I just remember that I always felt so strongly about my animals and wanting to help them when they were sick or injured. And, at some point I realized that I wanted to do that for other people too. I wanted to help them, when they were feeling stressed about their animals. By the time I got into vet school, I realized that small animal clinical practice wasn't really going to be for me. And I actually struggled a bit my first year of vet school because, I'd worked really hard to get into vet school. And I'd said my whole life I was going to be a veterinarian. And at the time, my only idea of what a veterinarian was somebody who, was hands-on treating animals.
Right. I think lots of people have that experience, actually.
Yeah. And so it was, it was really hard on me at first. But luckily, in vet school, I started to meet other veterinarians, and learn about other career paths that were more what we consider non-traditional and non-clinical. By the time I was coming up to graduation, I decided that I was going to do a PhD. After that, I was going to go and do the Epidemic Intelligence Service at the CDC. And I was going to have a blazing career in public health. So I was all set for that. But unfortunately, I didn't get into the PhD programs I wanted.
Okay.
So I was very disappointed at the time. But I needed a job to support myself. And I had really enjoyed my shelter medicine rotations during my 4th year of vet school. So I decided to get a job as a shelter vet.
Okay.
I absolutely fell in love with shelter medicine. I, really immersed myself in it. But after a few years, I find myself in a job that, I really needed to leave. And I was feeling a little burnt out. I also had this kind of itching feeling that, I wanted to go back to research and public health somehow. And so I quit my job and I went and did the Master's of Preventive Veterinary Medicine at UC Davis.
Okay.
And then I planned after that I would go on and do the Epidemic Intelligence Service at the CDC and have my, blazing career in public health. But when I finished the MPVM, the Masters of Preventive Veterinary Medicine at UC Davis, I applied for the CDC and I applied for a bunch of other public health and epidemiology positions, but I wasn't having a whole lot of luck with them. There are a lot of increasing opportunities for veterinarians in public health, but it can still be really challenging to break into the public health sphere, especially in areas that were traditionally thought of as really only associated with human health.
Right.
So at the time I was really disappointed, but it turned out to be to my benefit because, as I was applying to all these jobs, I came across the listing for VCA's veterinary epidemiologist position. As I started learning more about it and I started going through the interview process, I became really excited about the possibilities of this job. Most of veterinary epidemiology is centered in academic and regulatory settings, and it's traditionally focused on protecting public health in the food supply. So it was really cool to see VCA recognizing the value of having somebody trained specifically in epidemiology and public health to support our private practice veterinarians and hospitals, because they're the ones providing the vast majority of veterinary care to our patients and our clients. I think it seems really obvious, but I think as a society, we've only recently started to truly appreciate the interconnectedness between people and their pets and, begun trying to unravel both the benefits and the consequences of what that means that we live so closely together. And so it's been really cool to get to serve in this role at VCA and try to do my little part to work on that.
My initial perception of public health when I was in school and for many years was that in the veterinary sphere, it really focused more on large animal, which is not true at all. But I didn't know if you had kind of experienced that as well.
I think that perception actually is true to a certain extent. I think we've really spent a lot of time focusing on, animals that are used in our food supply.
Right.
And how we make sure that the food that's going out to consumers is, healthy and doesn't, have any contagions or anything that would harm people. It's really only recently, I think, that we've started looking at pet animals, as very, very important to public health and to human health. I mean, obviously, traditionally, we had things like the dog rabies projects in the United States, right, where private practice veterinarians are primarily responsible for eradicating rabies in dogs in the United States. It used to be a really big problem. So certainly it's not completely new to think of pet animals and public health, but I think it's definitely a growing field.
For those listening who aren't familiar with epidemiology, can you share an overview of that field of study and how it benefits animals and human health?
So the textbook definition that I usually give of epidemiology is that it's the study of patterns and causes of diseases in populations. And that can be human populations, animal populations, even plant populations. But obviously, that's a super simplified description of something that's really complex and really diverse. And so I actually find it kind of difficult to explain epidemiology because it can look like so many different things. It can look like an epidemiologist sitting at a computer analyzing data. They can create education campaigns. Epidemiologists often go into the field and collect samples for various diseases. And often an epidemiologist's job will actually encompass many of these different types of work throughout their time in that role, which is the case with my job, and which is something that makes it really fun for me.
So you joined VCA in 2018. How has your position changed? What were you doing at the beginning and what are you focused on now?
When I joined this role, the epidemiologist role in 2018, it was a brand new position for VCA. They'd never had an epidemiologist before.
Mm-hmm.
And there wasn't really a strict roadmap for what they wanted their epidemiologists to do. There were a lot of great ideas. So at first it was a little bit stressful, but it was also really exciting because it meant that I could kind of create my own position and fill in where I discovered that there were needs within the company. My position's really changed a lot over time, and it continues to change, which I think is really cool. So obviously during the COVID-19 pandemic,
you were a very popular person during the COVID-19 pandemic.
Yeah, I got completely sucked into COVID-19, right? Which made sense at the time, but I spent really pretty much all of my time focusing on the pandemic and, helping our hospital teams adapt to that and what that looked like for them and how they would continue serving, our patients and our clients while the whole world was really flipping upside down. And then also I spent a lot of time making sure that both our hospital teams and the general public had really good, reliable information about COVID-19 and pets. Things were changing literally day to day, sometimes hour to hour. And so I spent a lot of my time just trying to keep up with all the new information that was coming out and then trying to translate that to be helpful for our hospital teams with what they needed to know to be able to continue doing their jobs. And then also what that meant for pets and pet ownership.
Can you share with me a couple of examples of work that you produced early in the pandemic to help both keep patients and clients safe and to keep our associates safe and let them take care of the pets that needed help?
I think it all started February 2020. I was doing my job as normal. And, I got an email from someone within VCA saying, we have a reporter that wants to talk to someone about pets and COVID. And this was before things had shut down, really before the pandemic had taken off. And so at the time I was working out of VCA's office in LA. And so we did a live interview there.
Mm-hmm.
I tried to talk about what this new disease meant for pets. And really within a number of weeks, that all flipped upside down. And a lot of what I had said was no longer 100% accurate.
Sure.
And that continued to happen throughout the pandemic. I and, the rest of the public health world really was going by what we knew at the time. And so I'm sure there's still footage of me out there saying things like, at this time, there's no evidence that pets can be infected with the virus that causes COVID-19, which we now know is incorrect. So I did a number of videos that went out on Facebook, that went out on social media. I put together things like guidance and protocols for our hospitals, for how they should be handling different things. How do they deal with if a client has COVID, but their pet really has a true emergency and needs to be seen immediately? What do we do to protect our associates? So things like that. And I worked together with the legal team at VCA, the marketing team, all of the different groups to make sure that we were all working together to support our hospitals and our teams as best we could.
Yep, absolutely. And I am really, really grateful for your help during that time. Obviously, we know now that pets can get COVID, which we didn't know in the beginning. And you worked with our partners over at Antech Laboratories and did a study about pets in households of people with COVID. Tell me a little bit about some of your major findings in that study, and how did you go about collecting samples?
I'm really glad you brought this up because this study is really near and dear to my heart. And, I spent a lot of time and effort working on it. Like we were talking about, back early in the pandemic, we didn't know whether this new virus that caused disease in people could infect animals. We didn't know if it could make animals sick. Researchers at a number of universities started trying to answer these questions. But most of the projects that they were doing were restricted to certain geography, like the area around the university, or, a limited number of animals and people. So around this time, I met Dr. Christian Lutnager, who is the head of molecular diagnostics R&D at Antech Laboratories. And so he and I were actually brought together because we were both asked to serve on the Mars COVID-19 crisis response team. And he and I started discussing how there was really a need for a larger, more comprehensive study looking at COVID in pets. And eventually I said, well, if you can provide the diagnostic testing part, I bet I can put together a study through VCA. We can probably cover a good portion of the United States. We worked with the VCA clinical studies team, and what we ended up coming up with was a study to test dogs and cats that belonged to VCA associates and had been exposed to a human 19 case or cases within their own household. And in the end, we tested 1,000 dogs and cats from 44 states. And what we found was that 33% of the dogs and 27% of the cats had antibodies against SARS-CoV-2 virus, meaning that they had been infected with the virus. We also found that antibodies in pets correlated over time with reported human cases in the United States and had similar spikes during the major COVID-19 spikes. So we also looked at whether the amount of interaction or the types of interaction between pets and the people in their households with COVID-19 affected pets' likelihood to become infected with COVID-19. And some other studies found that various types of interactions matter, but in our study, we didn't see a major difference between the amount of time a pet spent with someone who had COVID-19 or the types of interactions that they had with the person and their likelihood of getting infected with COVID-19. Putting all of our results together with the results of other studies, what we know now is that between a quarter and a third of dogs and cats that are exposed to somebody in the household with COVID-19 eventually end up becoming infected with COVID-19. But we also know that they really rarely get sick from the virus. And when they do, the signs are pretty mild. So what we found through our study and the results of other studies is that only in the very strictest isolation, where you really prevent an animal from coming anywhere near an infected person, does it make any difference in whether the pet's likely to become infected or not. Big picture, what this tells us is the risk of them being harmed by COVID-19 is really low. And so in most cases, trying to minimize your pet's interaction with an infected person in the household doesn't make a huge amount of difference unless you really exclude them from that person altogether. The only exceptions would be in cases where, pets have an underlying condition that makes them really vulnerable or where they have compromised immune systems. And so in some of those cases, it might be advisable to completely isolate that pet away from infected people. But that's a decision that really needs to be made on a case-by-case basis with that pet's veterinarian.
And when you say conditions that make them vulnerable, give me a couple of examples of what that might be.
Yeah, so that might be something like cancer, where a pet's immune system is already working really hard. Maybe they're on treatments for cancer that, make their immune system more vulnerable. There are other sorts of times when a pet has a disease that is making them critically ill. Often those pets are in the hospital, but either way, when their immune system is working hard to fight off some other disease, we don't want to add anything else to it that the immune system has to worry about.
With what you were just telling me, you mentioned a little earlier that you worked with a VCA clinical studies team, which is now the Mars Veterinary Health Science team. Tell me a little bit about the interaction as an epidemiologist with the VCA clinical studies team.
Yeah, so I have to admit, working with our clinical studies team is actually one of my favorite parts of my job. I absolutely love research and the scientific method. And so I really enjoy getting to work with Dr. Phil Bergman and Talon McKee, which are part of our clinical studies team. At VCA, we have a really robust resident training program where we train doctors to become board certified specialists in surgery or medicine or oncology. And many of these specialties, they have a requirement for these doctors to publish a research paper in a scientific journal before they can complete their certification process. Many of these specialties, they have a requirement for these doctors to publish a research paper in a scientific journal before they can complete their certification process. And so in veterinary school, we're trained to be clinicians. We're trained to treat patients, but we don't get a ton of education on things like study design and statistical analysis. And so I often get called on to help our doctors really hone their research ideas, create a manageable plan for their study, and help them with things like statistical analysis, which luckily are things that I really enjoy. Also, to help facilitate this, VCA recently created our study design review board, which I'm really lucky to get to help with. This is a group of people within VCA who have experience with research or experts on particular subject matters within veterinary medicine. And the goal of this group is to really help our doctors who are doing research as early as possible in the study process so that we set them up for success right from the beginning. And we don't end up down the road with a project that they've put a lot of time and effort into, but is going to have difficulty getting finished or getting published for some reason or another. And going along with this, we also have what is called an institutional review board, or IRB, at VCA. And this is a group of people who are responsible for safeguarding the health and welfare of all individuals participating in clinical studies at VCA. And that can be our veterinary patients, our clients, or even our associates. So every study that involves a person or animal, rather than historical data, goes through the IRB to evaluate the ethics of that study. And I'm really lucky to get to participate in that as well.
So there's another disease process going on right now that is in the news a lot, avian influenza. What can you tell me about that disease process and what we know about it?
Yeah, so the current situation with avian influenza is really interesting because it's changing really rapidly. Even as we speak, we're probably getting new information about what's going on with it. For a bit of background, there are many different strains of influenza, which is commonly called flu. And some types are more likely to infect one species or one group of animals than they are another. The current type that is in the news and that is circulating in North America is called H5N1. And it was originally considered only a bird flu. And when it first came to North America in 2022, it actually did some considerable damage to our poultry populations. And it turns out that H5N1 is actually, this strain of it is actually really unusual because it can also infect a number of mammal species, including a number of different types of wild mammals. And it's even caused some large die-offs in the seal populations along our coastline. And in the past few months, we've started to learn that this flu that was really originally considered a bird flu, it also can infect dairy cows as well as domestic cats and people. But at this time, human infections are considered really rare, and they usually result from direct exposure to infected animals. And the CDC has ongoing surveillance efforts to try to minimize that risk. And for people who want more information, the CDC and the USDA, they're updating their websites with the latest information multiple times a week. And so by the time this podcast is aired, there may be new information that will be on those websites.
Perfect. Well, it certainly is a situation that bears watching closely right now. And you're absolutely right. The information produced at the CDC and USDA websites provide great, really up to the minute information and changes of what's happening. So I know that we're concerned about that and working to make sure that we have the information for our veterinarians and our veterinary team. And then another area that you're involved in is actually a big focus of Mars and Mars Veterinary Health as well, of sustainability. And a part of sustainability is antimicrobial use and having good antimicrobial stewardship. You and Dr. Silene St. Bernard are representatives to the Mars Veterinary Health group working on that. Tell me a little bit about what is antimicrobial stewardship and why should we be concerned with that in small animal care?
So right now within VCA and within Mars Veterinary Health, our focus is on antibiotic use. Antimicrobials describe a group of drugs that are used to fight multiple different types of organisms, such as bacteria and fungus, even viruses. But we're focusing specifically on antibiotics, which are drugs that are used to fight bacteria specifically. And so because bacteria reproduce at such a fast rate, they can develop various methods of resisting the effects of these antibiotic drugs, which means that over time, sometimes fairly rapidly, the antibiotics can become less effective at fighting those bacteria. This process is called antibiotic resistance, which is sometimes abbreviated ABR or AMR. Mm-hmm. And unfortunately, worldwide, we're seeing a really big increase in antibiotic resistance, both in people and in animals. And so antimicrobial stewardship and antibiotic stewardship in particular is really an effort to figure out how we can slow the development of this resistance and determine ways that we can use these drugs really in the most effective and smartest ways to help fight infections where we really need these drugs. Mm-hmm. And so that means that we really need to be very careful about how we use antibiotics and make sure that we're only using them in cases where there's a true bacterial infection. So what this means at VCA is that we are working, like you said, together with the other veterinary businesses that fall under Mars Veterinary Health to try to come up with strategies to help our doctors use these antibiotics in the best way possible. And so for VCA, our first step is trying to use our medical record data to understand kind of where we are now with antibiotic use, how they're being used, how much is being used, that sort of thing. And while this sounds like a really simple task, our data is actually really complex and it makes teasing out these things really challenging. But once we have a better idea of our baseline, then we can really start devising ways to help our doctors use these antibiotics in the smartest way possible.
Yeah, I appreciate that. And one of the things that we work on is we want to make sure that we use antibiotics, which treat bacterial infections, for things that are bacterial infections. We saw this in human healthcare for years, that physicians would use antibiotics to treat, the common cold, but the common cold is not a bacterial infection in people. So that's an example of using an antibiotic in a situation it's not needed, which is one of the factors that can lead to resistance. A lot of it is education. A lot of it is, I think, as veterinarians, they are concerned that if they don't prescribe something, they might miss an infection. So it's no small task, and I'm really happy that we're working on it and trying to address that, because this will have a major impact on both human and animal health far into the future. So last time you and I were having a meeting, you mentioned that you had been volunteering at a shelter. Tell me about your shelter volunteer work.
Like I mentioned earlier, I started out my career working full-time as a shelter veterinarian. Mm-hmm. And although I don't do that full-time anymore, I still feel really strongly about shelter medicine and feel really connected to that community. Right now, I do relief work for shelters to go and help them primarily with spays and neuter surgeries. Mm-hmm. But I also do volunteer work as well, both locally. And then a couple of years ago, had the incredible opportunity to go to the Galapagos Islands and spay and neuter dogs and cats there, which was really, really cool. Something that a lot of people don't realize is modern shelter medicine goes far beyond just the care of lost and homeless animals, although that's still a really huge part of it. But it entails things like spaying and neutering dogs and cats. And the goal behind that is to help mitigate pet overpopulation, which is a huge problem in most parts of the United States right now. Mm-hmm. And that pet overpopulation is actually a huge part of what leads animals to end up in the shelter, where we then struggle to take care of them and struggle to find them new homes. Another big part of shelter medicine these days is trying to provide education to people and really meet people where they are in their lives in order to help keep pets in their homes. People surrender their animals to the shelter for a variety of reasons. Mm-hmm. Often it's because they feel like they have no other option. They really care about those animals. They would really like to keep those animals, but for various reasons, they feel like they've run out of options. And so they feel like they have to take that animal to the shelter. And so a big part of shelter medicine right now is how do we support those people to make sure those animals never end up in the shelter in the first place? Like, how do we help them figure out what they need and help provide that to them? And so that's something that I'm really passionate about and try to do what I can to help that sort of work where I can.
We are about at the end of our time today, and as always, I've tremendously enjoyed speaking with you. But in closing, you've had a number of professional experiences early in your career. What advice would you share with today's vet students and early career veterinarians and technicians for their future to find the right path for them?
I think the biggest advice I would give to early career veterinarians and people in the early parts of their career, regardless of what their role is in veterinary medicine, is to never let yourself be convinced that you're pigeonholed into one type of veterinary medicine or one type of practice just because that's what you studied in vet school, or that's what you've been doing, or that's what you're most familiar and comfortable with. Don't get discouraged if the job you think you want isn't immediately available, or if you don't get it when you apply. This job is not the job that I ever pictured myself in. When I first saw this job, it looked so cool and so unique, albeit a little scary and daunting, but it was just such a cool opportunity. And I'm so glad that I kept an open mind and I went for it, because now that I'm in this position, I wouldn't trade this job for any of those other jobs that I thought I wanted.
Well, I'm very, very lucky to have you on my team, Ann. So thank you so much. Thank you for speaking with me today and sharing your experiences.
Thanks so much, Marie. This was really fun.
Thank you so much for listening in. If you enjoyed today's episode, please consider subscribing. Don't forget to leave a review to let us know your thoughts, and share the episode with friends. Follow VCA Animal Hospitals on social media at LinkedIn, Facebook, and Instagram. For more inspiring stories, visit our website at vcavoice.com.